Hello. I want to try something a little bit different today. I know usually when I'm doing these presentations, I am totally focused on doing PowerPoints, but recently, somebody told me that PowerPoints are starting to get on people's nerves, and maybe it's better to just talk to people. So, this presentation is about health inequalities in disasters. So, mechanisms, methods, and some responsibilities. The session focuses on the central premise in disaster science that disasters do not affect all populations equally. Rather, they magnify existing inequalities across individuals, communities, and systems. Drawing on chapters 10 to 14 in your textbook on handbooks of disaster research, we will examine how inequalities often are produced and how they are measured, and how research design can either reveal or obscure them. This is not only a theoretical issue, it has direct implications for how we conduct research, interpret findings, and design health system responses. By the end of the session, you should be able to do three things, at least three things. First, describe the mechanism through which disasters disproportionately impact marginalized populations. Second, critically evaluate disaster studies for how well they address equity and methodological rigor. And third, identify ways to incorporate health equity into your own research design and interpretations. As you listen, I encourage you to think about your own research questions and where equity considerations could be strengthened. So let's talk about a core premise. Disasters are amplifiers. A consistent finding across disaster research is that disasters act as amplifiers of existing social conditions. They do not create inequalities from nothing. Instead, they expose and intensify patterns that are already present. For example, populations that experience limited access to healthcare before a disaster are more likely to experience worse outcomes during and after the disaster. Similarly, communities with fewer economic resources often have less capacity to prepare, evacuate, and recover. This shifts the focus of disaster science. So rather than asking only what was the hazard, we also need to ask what was affected and why. The perspective requires attention to the broader social, economic, and political context in which the disasters occur. Anybody that was around during Hurricanes Katrina and Rita saw this um, as it unfolded live before us, as we saw some people able to evacuate, other people not. Some people able to access health care, others not. And then the list goes on from there. So, some of the mechanisms of inequality are important to consider. And there are four primary mechanisms through which inequalities emerge in disasters. The first is differential exposure. This refers to the fact that not all populations are equally likely to encounter a hazard. Where people live, work, and travel shapes their exposure risk. For example, lower income populations may reside in flood prone areas or regions with higher environmental risk. So, do you live next to the plant that produces toxic chemicals? Um, the second mechanism is differential vulnerability. This includes underlying health conditions, age, disability status, and other factors that influence how severely someone is affected by exposure. The third mechanism is differential access to resources. This includes access to transportation, information, healthcare, and social support. Barriers in any of these areas can limit the individual's ability to prepare for and respond to a disaster. This fourth mechanism then is differential response and recovery. Institutional response is not always evenly distributed. Some communities receive more rapid or more comprehensive support than others. Recovery resources, including financial assistance and rebuilding efforts, may also be uneven. These mechanisms are not independent. All of these mechanisms, all four, interact and accumulate over time. Let's talk a little bit about structural vulnerability. To understand the mechanisms more deeply, we turn to the concept of structural vulnerability. And structural vulnerability refers to the ways in which social, economic, and political systems shape risk. This includes policies, institutional practices, and historical patterns that constrain individual choices and opportunities. For example, residential segregation can result in certain populations being concentrated in higher risk areas. Now, legally, we don't allow this anymore, but it doesn't mean it does not exist. Labor conditions may require individuals to remain in hazardous environments during extreme events, and access to healthcare may be limited due to cost, availability, and geographic barriers. The key point is that vulnerability is not simply an individual characteristic, it is produced through systems. From a research perspective, this means that focusing only on individual level variables may lead to incomplete or misleading conclusions. Um, the chapters extend the concept of social determinants of health into the disaster context. Important variables include income, education, race and ethnicity, age, disability status, and immigration status. Social capital is also critical. Networks of support can influence access to information, resources, and assistance. When you encounter people in a disaster, one of the things you need to know is what is the social support network? Are there community centers? Are there churches where their first language is spoken? However, one of the challenges in disaster research is that these variables are often incompletely measured. Administrative data sets may lack detailed information on social conditions, and as a result, researchers may rely on proxy variables, which may not fully capture the lived experience of inequality. And this also creates measurement bias. Um, and then we know that there are inequalities in the health systems. Disasters disasters really reveal the inequalities that are existing within our health systems. For example, hospitals differ in their surge capacity, their staffing, and their access to supplies. Public health infrastructure varies across regions, affecting surveillance, communication, and response coordination. And access to care may be disrupted unevenly, with some populations facing greater barriers than others. These system level inequalities can be compounded then by individual vulnerabilities. For nursing practice, this highlights the importance of understanding both the patient level and the system level factors. Let's talk a little bit about methodological challenges. Of course, a major theme across these chapters is the challenge of studying inequality in disaster research. There are several key methodological issues that you need to be aware of and you need to dig deeper into. First is data limitations. Many of the data sets do not include detailed information on social determinants or marginalized populations. Some data sets, for example, really don't track race, ethnicity, what the person does for a living. So you don't know what a person's exposure may be. Second is sampling bias. Certain populations, such as undocumented individuals or those experience homelessness, may be underrepresented or excluded. Also, keep in mind, a lot of the data we use for research comes from CMS, which means older adults. You're necessarily probably excluding all the people who are middle-aged and employed. Uh, Third is a scale mismatch. Data may be available at a county or a state level, but inequalities may occur at a much smaller scale. And this is a huge problem because all the de-identified data sets de-identify by county. County is the smallest data that you can get. And so you can't get zip code level data. And this is one of the downsides of HIPAA rules. Fourth is temporal dynamics. So vulnerability and recovery change over time, but many studies use cross-sectional designs that capture only a single point. These limitations affect the ability to accurately identify and interpret disparities. So let's move on to measurement of inequity. To address the data gaps, as researchers, you have to use composite indices, such as social vulnerability indices. And these indices combine multiple variables to create a summary measure. And this is useful, but it also results in some, well, it raises some important questions. Do they capture the complexity of vulnerability? Do they measure variation within populations? Are they sensitive to change over time? When evaluating research, it's important to consider whether these measures used actually align with the concept that you're studying. So you have to have a study design that works for equity. Design choices play a critical role in whether inequalities are visible in the research findings. Several approaches can strengthen the equity focus of the research, including marginalized populations and sampling strategies. Mixed methods approaches can provide context and capture experiences not reflected in quantitative data. The longitudinal design allows for examination of recovery and long-term outcomes, and integrating geospatial data and social data can improve the understanding of place-based inequalities. The key point is that equity must be built into the design of your research from the very beginning. Equity is also an ethical issue. Researchers must consider how populations are represented and whether participation leads to benefit. There is a risk of extracting data without contributing to improved outcomes for communities. Engagement with communities and respect for local knowledge is essential. And ethical disaster research requires attention to both process and research and its implications. So let me give you just a few closing thoughts. Um, Disasters magnify the existing inequalities through multiple interacting mechanisms. Understanding these mechanisms requires careful attention to both theory and method. As you complete your article reviews and as you read through the research, I encourage you to ask, how is inequity defined in the study? Is it? How is it measured? Who is included and who is excluded? Do the conclusions reflect the data and the methods used? And importantly, how could the study be improved? These questions really are central to advancing disaster research that is both methodologically rigorous and responsive to real world inequities. I would also encourage you to take time to look up the 7 vital conditions of health and well-being and to make sure you're aware of those, because that really is a tool that the government has used for resilience. And I think you will see that it takes a different approach than the social determinants of health. It's a little bit broader in its perspective, and it may be a little more useful for disaster research. Thank you, and thanks for listening. If you have any questions, please feel free to reach out to me.